Anna Berger joins us now. She is the Secretary-Treasurer of Service Employees International Union and Chairwoman of SEIU's Change to Win campaign. Great to see you. Thanks so much for joining us.
It's good to be here.
I guess the first question, the fundamental question, we talked to Olympia Snowe, who said there will be no public option in the Senate version. We talked to Jim Moran, and he's echoing Nancy Pelosi, saying there has to be a public option in the House version. How do they pull this together and come up with a bill?
Well, I think that it's important to get the process moving, so I hope that the Finance Committee finally gets their bill out. Whether it has a public option or not, I believe that the public option will be debated on the floor of the Senate, and I'm confident that at the end of the day, we will have a public option.
Is that a demand? Is that a bottom line demand for your union?
We need to figure out a way to hold down costs, and the public option is the best plan that we've heard to date that will hold down costs. We think that it's really important to solve the health care crisis now. You know, if you think about what's going on in America, this week and every week in America, 44,000 people lose their health care. 17,000 people file for bankruptcy because of health care costs, and 400 people die because of lack of health insurance. And so this is a critical problem. We know that we have to make sure that it's available to everybody, but we also have to contain the costs. The public option does that. We think it's the best way of doing that.
Why not the co-ops?
Well, first of all, the co-op has never been done nationally. It's only been done in 2 small markets. So we have no proof that it's actually going to hold down costs other than for the co-op itself. Not that it will drive down any costs, because they have no national purchasing ability or national operational ability. I think that the public option is something that we could gear up, it could work, and it's an option. It's not something that we're going to mandate for people. It's something that people can opt into, and I think it's a good choice.
But it's a deal breaker if it's not in there.
Well, I think that this is an important thing for us to all move forward on. I want to see the debate in the Senate. I am positive that at the end of the day, my belief is that we will have a bill that works for everybody. One of the ways to make that work is a public option. So we are out there, we are going to town hall meetings, we are calling our members of Congress, we are calling the Finance Committee to say we want to solve this problem. And the way to do it is to include a public option.
Anna Berger from SEIU, thank you very much, representing more healthcare workers, I believe, than anyone else in the country.
Absolutely, we do. And that's why we care about healthcare so much. We see what happens when you don't have it.
Thank you. Great to see you again.